Many men assume that their penis stops functioning well simply because they're getting older. But the truth is, aging isn't the real culprit. Your daily habits are. Every day, thousands of men unknowingly harm their sexual health, not because of illness, but because of what they don't do, the care they overlook. Over time, that quiet neglect adds up until one day, the man staring back in the mirror feels like a shadow of who he used to be. I'm Dr. James Ellison, a board-certified urologist and men's health specialist with more than 30 years of experience helping older men reclaim their vitality, self-confidence, and sexual well-being. I've worked with men from every background, retired teachers, veterans, grandfathers, and I can tell you with certainty, your best years are not behind you. What if I told you your penis needs regular exercise just like your heart does? Not for appearance, but for strength, healthy blood flow, and control. And what if the care it requires is far simpler than you might think? In this video, I'll guide you through 4 essential exercises and care habits every man over 60 should practice. Natural, science-backed, and life-changing. They're natural, effective, and life-changing. And if you stay with me until the end, I'll reveal one nighttime mistake silently ruining erections in men across America. Before we get started, if you're serious about improving your sexual health naturally and aging with strength, make sure to subscribe and turn on notifications so you never miss a practical doctor-backed tip designed specifically for men like you. And if this message resonates with you, type 1 in the comments. If not, type 0. Your feedback helps me make this content more helpful for you. Let's begin with the first and most essential step, one that forms the foundation for nearly every aspect of your sexual health. It's something most men overlook, yet it has a direct impact on your ability to achieve and maintain an erection. I'm talking about strengthening your pelvic floor. 1. Pelvic floor exercises, the foundation of erection control. As men age, it's easy to assume that changes in erection strength or urinary control are simply part of the process. But often what's really happening beneath the surface is a gradual weakening of the pelvic floor muscles, the very group of muscles that support the bladder, bowel, and yes, the penis. These deep, unseen muscles are responsible for the firmness of your erection and your ability to control ejaculation. When they weaken, blood doesn't stay trapped inside the penis as effectively, leading to softer erections that are harder to maintain. The good news is that strengthening your pelvic floor is not only possible, it's simple. Pelvic floor exercises, commonly called QL, are one of the most effective low-effort tools for improving sexual performance, especially for men over 60. They don't require any equipment, they don't cause side effects, and you can do them discreetly at home, sitting, lying down, even while watching TV. To perform a QL, tighten the muscles you'd use to stop urinating midstream. Hold the contraction for 5 seconds, then relax for 5. Repeat this cycle 10 to 15 times per session, ideally 2 to 3 times a day. As your strength improves, you can increase the duration of each contraction. Think of it like going to the gym. Small, consistent repetitions lead to long-term results. With just a few minutes a day, many of my patients experience noticeable improvements in firmness, stamina, and bladder control within a few short weeks. What surprises many men is that these exercises don't just help during sex. They also reduce nighttime urination, post-void dribbling, and the urgency that can make social outings stressful. Imagine being able to sleep through the night without waking up to use the bathroom, or being able to laugh with friends without worrying about leaks. That's the power of a strong pelvic floor, and it's entirely within your reach. But here's something most doctors won't tell you. Pelvic floor strength is only one part of the equation. To keep your erections healthy, your penis also needs regular blood flow, whether you're sexually active or not. And that brings us to the second technique, one that may feel unfamiliar at first, but is absolutely vital if you want to maintain natural function and prevent long-term damage. let's talk about how to exercise your penis for better circulation and why doing this daily can protect you from one of the most common and preventable causes of erectile decline. If you're still here and these insights are resonating with you, type the number 1 in the comments to let me know you're following along. Now, let's keep going and dive into the second essential habit you need to know. 2. Vascular stimulation. Exercise for your penis. When we think of exercise, we often imagine jogging, lifting weights, or stretching, movements that strengthen muscles and improve circulation. But one organ that's often left out of the conversation is the penis. Just like your heart or legs, your penis relies on strong, consistent blood flow to stay healthy and functional. And the reality is, as men get older, that blood flow begins to slow. Arteries become narrower, tissues less elastic, and if the penis isn't being regularly oxygenated, it starts to lose strength, literally. This is where vascular stimulation comes in. Think of it as a daily workout for your sexual health. The goal isn't arousal or climax, but circulation. By encouraging blood to regularly flow into the penis, you're helping to maintain the tissue, keep the vessels flexible, and support healthy erectile function. One of the most effective ways to do this is through the use of a medical-grade vacuum erection device, also known as a VD. This is a safe, drug-free tool that gently draws blood into the penis, even when you're not sexually stimulated. Used for just 5 to 10 minutes a day, it can preserve length, sensitivity, and overall tissue health. But you don't need a device to get the benefits. Gentle manual stimulation done mindfully and without the goal of orgasm can also help. The key is consistency. A few minutes each day of encouraging natural blood flow sends oxygen to the tissue, supports nerve function, and keeps the erectile chambers from becoming fibrotic or atrophied. This is especially important for men who are not currently sexually active, whether due to health, relationship status, or personal reasons. Without regular stimulation, the body assumes that area is no longer in use, and the results can be a quiet decline in function that's harder to reverse later on. One condition this approach can help prevent is Peyronie's disease, a common, often misunderstood issue where scar tissue builds up inside the penis, leading to painful curvature and difficulty with erections. Keeping the tissue supple and well oxygenated reduces that risk significantly. Vascular stimulation is about proactive care. It's how you preserve what you still have and protect it for the years ahead. But blood flow is only one part of the puzzle. Next, we'll talk about a form of care most men overlook completely. Something as basic as how you clean your penis and why doing it the wrong way can silently increase your risk for serious health problems, including cancer. 3. Skin and hygiene routine. The overlooked daily habit. Most men don't think twice about how they wash their penis. It's usually a quick rinse in the shower, maybe even skipped altogether on slower days. But what seems like a minor habit can have a major impact, especially as you age. Proper hygiene is not just about cleanliness or smell. It's a vital part of protecting your sexual health, preventing disease, and ensuring your penis stays comfortable, functional, and free of long-term issues. In fact, poor hygiene is one of the leading risk factors for infections, irritation, and even penile cancer, a condition that affects more older men than many realize.
As we get older, our skin becomes thinner, more sensitive, and slower to heal. This makes your hygiene routine even more important. The skin of the penis, especially under the foreskin for uncircumcised men, can trap bacteria, sweat, dead skin, and other substances that create the perfect environment for inflammation and fungal overgrowth. That inflammation isn't just uncomfortable, it can lead to conditions like balanitis, recurring infections, or contribute to long-term skin changes that make sexual activity painful or difficult. The solution is both simple and powerful. Use warm water and a mild, fragrance-free soap like glycerin or baby soap to gently clean the entire penis, including under the foreskin if you're uncircumcised. Take your time. Make sure to rinse thoroughly and, just as importantly, dry the area well afterward. Damp skin is a breeding ground for bacteria and fungus. After sex, always clean yourself, even if you're tired or it's late at night. The vaginal pH is different from your skin's, and the residue can disturb your natural balance, leading to irritation. For some men, especially those prone to dry or cracking skin, a fragrance-free hypoallergenic moisturizer once or twice a week can help keep the skin supple and reduce discomfort. It's not about vanity. It's about preserving the skin's ability to stretch, protect, and function as it should. These small daily habits might seem minor, but over time they create a huge difference in how your penis feels, performs, and ages. Hygiene is a form of respect, not just for your body, but for your well-being and your partner, if you have one. Still, cleanliness isn't the only hidden factor at play.
There's another piece to this puzzle, one that has nothing to do with soap or muscles, but everything to do with what's happening inside your mind. Let's explore how your brain and your breath can have a direct impact on your erections. If you're still watching and finding this information valuable, go ahead and type the number 1 in the comments. It lets me know you're here and engaged. Now, let's continue with point number 4. 4. Mind-body practices, because erections start in the brain. For many men, when sexual performance begins to decline, the first instinct is to blame the body. Maybe it's low testosterone, poor circulation, or just age catching up. But what often goes unnoticed is how much of your sexual response is governed not by your body, but by your mind. The truth is, mental and emotional health play a central role in your ability to get and maintain an erection.
And as you grow older, factors like stress, anxiety, grief, loneliness, and even unspoken fears about aging can silently interfere with your body's natural responses. When the mind is tense, the body follows. Elevated stress hormones like cortisol directly block nitric oxide, the chemical responsible for relaxing blood vessels in the penis. Without that relaxation, blood flow is limited and erections become weaker, slower, or disappear entirely. That's why one of the most powerful things you can do to support your sexual health doesn't involve pills, devices, or even movement. It's learning how to quiet your nervous system and reconnect with your body. Simple breathwork exercises are incredibly effective.
Just 5 minutes of slow, intentional breathing a day can lower cortisol levels, reduce blood pressure, and increase nitric oxide naturally. One technique I often recommend to my patients is the 4 to 46 breath. Inhale for 4 seconds, hold for 4, exhale slowly for 6. As you do this, picture warmth and blood flow spreading through your body, i.e., including your groin. Over time, this builds a deeper connection between your mind and your physical response. It's not just about relaxation, it's about retraining your body to respond with calm confidence instead of performance anxiety or mental distraction. Another powerful tool is mindfulness. Many older men tell me they feel disconnected from their bodies, like their mind is stuck in the past, remembering how things used to be, rather than engaging with what their body can still do today. Practicing mindfulness, even for just a few minutes a day, helps ground you in the present moment, rebuilds self-awareness, and improves both sexual satisfaction and emotional well-being. It also reduces the performance pressure that can become overwhelming, especially after a few experiences of frustration or embarrassment. These mind-body tools are just as important as physical exercises or hygiene. They bring the whole system into balance: nervous system, hormones, circulation, and self-confidence. But there's still one more surprising habit that quietly affects your sexual health while you sleep. It's something most men never think about, and yet it may be the reason you're waking up with fewer morning erections. Let's talk about the impact of what you wear or don't wear to bed. Bonus tip: sleep without tight underwear. One of the most overlooked aspects of sexual health has nothing to do with what you do during the day and everything to do with what happens while you sleep. Most men are completely unaware that the type of underwear they wear to bed can silently influence their erectile health. It may sound trivial, even a little strange, but the science is clear. Wearing tight underwear at night can contribute to a gradual decline in penile function. Here's why. Even as you age, your body continues to produce spontaneous nocturnal erections. These are healthy, natural, and incredibly important. They keep the penile tissue oxygenated, the erectile chambers flexible, and the blood vessels active. But when you wear snug briefs or constrictive underwear to bed, those erections can be physically restricted or even bent against the fabric. Over time, this repeated pressure causes microtrauma, small internal injuries that you won't feel in the moment, but that can build up into something much more serious. These micro tears can lead to scarring beneath the surface of the skin, a condition known as fibrosis. And in some men, this develops into Peyronie's disease, a painful curvature of the penis caused by hardened scar tissue. This can interfere not just with function, but with confidence, comfort, and intimacy. What's frustrating is that many men never realize the cause. They may blame aging, past partners, or medical conditions, when in fact, it's a simple nightly habit causing slow, long-term damage. The solution is refreshingly simple. Allow your body to breathe and move freely at night. Sleeping without underwear or switching to loose-fitting cotton boxers gives your body the space it needs to function properly during these essential nighttime erections. It may feel unfamiliar at first, but many men report better sleep, less irritation, and even a return of stronger morning erections after making the switch. This is a perfect example of how small choices, the ones we often ignore, can make a big impact over time. Sometimes it's not about trying harder. It's about removing the things that silently get in your way. Now that you've learned the most essential daily care habits and exercises to support a strong, healthy sex life after 60, there's one final message I want to leave you with. One that ties everything together and reminds you why your health, confidence, and vitality are absolutely worth fighting for. Let's wrap this up with a final word from the heart. Final words from Dr. James. If you've made it this far, you've already taken the first and most important step, showing up for your own health. That alone sets you apart. Too many men over 60 silently accept decline as inevitable, assuming that less energy, weaker erections, or loss of desire is just how it is. But the truth is, your body still listens. It responds to care, to effort, and to small, consistent choices. No matter your age, we've talked about 4 key practices that support your sexual health in real, tangible ways. Strengthening your pelvic floor is the foundation. It gives you control, endurance, and confidence from within. Daily vascular stimulation keeps blood flowing where it's needed most, protecting against shrinkage, tissue damage, and loss of sensation. A proper hygiene routine is more than basic self-care. It's a safeguard against irritation, infection, and even serious conditions like cancer. And mind-body practices like breathwork and mindfulness help regulate the quiet, hidden systems that control everything from blood pressure to desire. These aren't gimmicks. They are science-backed habits I recommend to my own patients. And the men who stick with them often report real transformation, not just in their sex life, but in how they feel about themselves. Even something as small as changing what you wear to bed can make a lasting difference. Your health isn't just shaped by major moments or medical visits. It's shaped by what you do day after day when no one's watching. These choices build on each other. They send a message to your body. I still care. I still want to feel alive. I still believe in what's possible. And if there's one thing I want you to remember, it's this. Age doesn't take your strength from you. Giving up does. You have more power than you think, and there is no expiration date on your right to pleasure, to intimacy, or to a body that works for you, not against you. If this video helped you, share it with someone who might need to hear it too. And don't forget to subscribe, because I'll be sharing more doctor-backed advice made especially for men like you. You've taken the first step. Now keep going. Your best years are still ahead, and you deserve every one of them.